Welcome to Saving Lives in New Jersey with the COVID-19 Vaccine, a video podcast presented by the New Jersey Department of Health. I'm Dr. Meg Fisher. I'm a Pediatric Infectious Disease Consultant and a Special Advisor to the Commissioner of Health. And today, joining me to discuss the importance of COVID-19 vaccination among workers in long-term care settings is Lisa Williams. Lisa, can you tell us a little bit about yourself?
Sure. Thank you, Dr. Fisher. I have been in long-term care for about 20 years, and I'm currently the Executive Director for Maplewood Senior Living at our property in Princeton. I currently chair the New Jersey Assisted Living Council for the Healthcare Association of New Jersey. I've been an administrator in long-term care for about 16 years. So I've seen a lot of changes in long-term care and assisted living, but nothing like we've witnessed in 2020. So my experience actually goes from hospital to a long-term care setting.
Fantastic. Now, you know, the long-term care residents and your staff has been eligible for the vaccine since we got it in New Jersey.
Yes.
Why is it so important that they be included in that first group of people to get the vaccine?
Well, I think that the long-term care workers have truly been on the front line. And I know that there's a lot of talk as far as the doctors and nurses in the hospitals and what they've gone through on the front lines. But the long-term care workers signed up for a job to take care of people. And we really lost a lot of that control with the pandemic and COVID-19. So it's important for them to really get the vaccine and help themselves and shield themselves from getting it themselves, because they have it twofold. They can get it out personally. They can get the virus out if they're out personally doing something, or just from coming to work every day. So for them to be protected, I think, is really important.
No question about it. What have you done in your facility to really educate those the staff and your clients to really get this vaccine?
Well, we've done a lot of town hall meetings so that the staff can ask questions as far as the vaccine is concerned, because they might not be watching the news. What I saw as a difference is my residents are watching the news all day. So they're seeing everything that CNN or MSNBC or any news outlet has to offer, whereas the workers are doing the work. And when they're going home, they might not be watching the news. So it really was the responsibility of the leadership of the facilities to educate the staff as far as the importance of the vaccine and answer any questions they might have, because it was a lot of the fear of the unknown as far as the vaccine was concerned.
Yeah, I think that fits with what we're seeing in lots of areas. What was the uptake among your staff and your residents?
Well, we had a clinic on Friday. The facility I was working at had their clinic on Friday, and we actually had a great participation rate from that. We saw 69 staff and about 110 residents get the vaccine. So that's well into 70% of the population of the facility receiving it. So I think that's a testimony to the work that we did to educate and make ourselves available to answer questions that they might have.
Absolutely. What are you seeing as far as the hesitancy goes? And those 30% who didn't get it, what were their concerns?
Some of it was just the fear of the unknown. There was a lot of uncertainty as far as the speed and the rollout of the vaccine. So again, that really goes to the education of showing them that, you know, the scientists are working on vaccines all the time. But, you know, the question came up a lot about, well, how is it that we can get a vaccine for this so quickly, but there's not a cure for cancer or something like that? So it really does, you really have to put yourself in their shoes to see why there might be some hesitancy. And then it also goes to the hesitancy related to the flu shot, because people have allergic reactions to it. And they're just thinking any vaccine, aside from the things that you need to enter school as a child, are just optional. And what we're seeing now is the COVID vaccine is really should not be an option for people that are putting themselves at risk every day.
I couldn't have said it better. And I'm very impressed that you got 70% of your people immunized. What advice would you give to other administrators at other long-term care facilities?
Well, I think you have to make it fun, and you have to kind of meet them where they are. if they're scared, kind of join that journey with them and go through why are they scared and what are they scared of? Because my statement all the time was, I've seen people die from COVID, residents that we've had, or even actually a family friend. So it's worth the risk to really protect yourself and to protect your family and to try to get back to some normalcy, although we know this is probably going to be a new normal that we have to deal with for a while. But I can't imagine not protecting myself if I could.
Fantastic. Thank you so much. I really appreciate you joining me.
Oh, thank you, Dr. Fisher. It's my pleasure.
For our listeners, I want to thank you also for listening in today. And I want to give you a place where you can go to learn more about COVID vaccine in New Jersey. This is a website, covid19.nj.gov/vaccine. Just as we're getting into getting everyone immunized, that's great. But all of us, even the immunized people, need to continue those safety behaviors that are so important for trying to control this epidemic. Wear a mask. Stay physically distanced, at least 6 feet if you can, from other people. Avoid crowds. Wash your hands. And when you're sick, please stay home. Protect yourselves, protect others, because, we can do this together. So thank you for watching, and stay safe, New Jersey.